Naloxone administration and the warm handoff program are life-saving services, but are not the cure for substance use disorders. Connecting to treatment and recovery is essential to minimize the risk of further overdoses. The road is challenging and requires a commitment by the individual to a plan of recovery. Just as each individual is unique, a treatment and recovery plan is designed to meet those unique needs. In this video, we will explore the treatment and recovery resources available. Opioids and alcohol are the most common drugs used by individuals entering treatment. However, recently, stimulant drugs such as methamphetamines and cocaine have also evidenced an increase in usage. Therefore, it is important to become familiar with the different treatment approaches for these drugs.
It is important to understand that treatment is an inoculation. We can compare it to much like if someone has a cold, they're going to get inoculated with medication. Recovery is a process, and I think it's important that we understand it's not an event. So the inoculation that you would get as part of treatment, it's kind of that phase in an individual's life whereby they're getting information, they're getting opportunity to get support, they're in an environment where they can get nurturing, perhaps some opportunity to talk about what addiction has cost them and be able to get some coping skills so that they're not returning to the behavioral problem.
Once the person has reached a point that they're deciding where they're going for their treatment, if they're talking with a recovery specialist or they're talking to their medical team and they're recommending a higher level of care, with the recommendations of different types of treatment centers, they'll then talk to that center and that center will do an assessment.
They need to be referred to an appropriate level of care. And that will vary. That depends on the drugs that they're using, their history of drug use, their present condition, whether they need to have a medically managed detoxification or whether they just need to go to a rehab. During a detoxification stay in a detox unit, that is a little separate from a rehabilitation unit. So in the detox unit, the focus is on managing the symptoms, keeping the patient safe. There are groups and some counseling available, but it's difficult for the patients to really fully participate in that because they are uncomfortable. So when they have finished the medically managed taper, then they're transferred to a rehabilitation unit.
Once you are medically sound in detoxification, you are normally moved to a group setting with other people who are there to do the same work on their substance abuse disorder, and there you'll see you will have a therapist, you'll have group therapy, you'll have nutrition work, you'll have some physical work because we all need to get healthy now. Our body's been broken down.
MAT officially stands for Medication Assisted Treatment. It is a medication that helps a medical disease. Because sometimes you get a patient who's interested in and motivated to be in recovery, but their brain has been hijacked. And while they're sitting there trying to get this information from the counselor, from their sponsor, from a meeting, their brain is out saying, where am I going to get my next fix? So sometimes you need to quell that first and say, okay, I can't stop thinking and doing this, so let's put a brake on it. And now that I've got your attention, and now that you're not jonesing, now that you're not in withdrawal, now let's start talking about what has happened in your life to get you to this point.
For the medications that are available for medically assisted treatment are methadone, which everyone has heard about. Also there's buprenorphine available, which has the brand name is Suboxone. I think there are some other generic brands available now. Then there's also Vivitrol. The one that has been around the longest, obviously, is methadone, that has been around since the 70s. And methadone occupies the same part in your brain so that that will block withdrawal symptoms. The other part about methadone is that it stays in your system for a long time, between 24 and 36 hours. So it gives you a very steady state to feel comfortable if you had been going through opiate withdrawal. So you feel very comfortable with it. It's a medication that was used in an outpatient setting because you can take it once a day and go about your daily life, and then you will be fine. Vivitrol acts differently from methadone. Vivitrol blocks the effects of any opiates that you use. So some patients sometimes say, well, I used, but I couldn't feel anything. So then you don't have the reinforcer. So when they do not feel the reward, which is the euphoria, eventually that connection is extinguished. Every medication-assisted treatment program must have a behavioral component. It's not enough just to provide the medication, because you need to change the behaviors that are engaged in when you're using an opiate.
Stigma is all around us, and more than just an addiction, but I'll focus on addiction. And it is so rampant, it's even within the community, within the recovery community, which is horrible. There are less now than there were before, but there still exist meetings that will not accept patients who are on medication treatment.
There is a strong connection between mental health disorders and substance use disorder. And if an individual just solely goes to treatment for substance use disorder, now they have an untreated mental health diagnosis, that can be a challenge because the individual still doesn't feel like they're connecting, like they feel okay. And that can be a trigger for someone to return to use.
I always look at it as a person who's in recovery is how is the person actually working on themselves and working on the recovery. And then if they surround themselves with all the other things that are available with the therapy that they're doing, if they get involved with the 12-step program, if they get involved with Dharma recovery or Smart recovery, the chances are greatly increased that they will continue on in the recovery.
We might say something like, we used to live and we live to use. Their whole mantra for living is dictated upon what access to substances that they can garner from. So the brain has changed. It is a brain disease, and for that the brain has changed. So now we enter into the realm of recovery. The brain hasn't fully equipped itself to know that coping mechanisms has to be premier, and instead individuals may become overwhelmed. Stress may be resulting of that. They may experience anxiety. And if they don't have the accurate coping skills, the accurate support systems in terms of family, friends, and employers, and they're left to their own devices, then chances are they will return to use, unfortunately.
It's really important for the family to get educated, to understand the issues that are going along with the person that might be having the substance abuse disorder, but then for them to work on themselves. And there's all sorts of other support groups out there for the families to be able to get the education, support themselves, and then maybe they can help support some other person in their family circles who has another person that might have an issue with a substance abuse disorder.
As a person in long-term recovery of 32 years, I can sit here and attest for you. Today, my integrity, my self-awareness is much different than how I saw myself even 10 years ago, 20 years ago, and certainly 30 years ago. I know that I have made some tremendous strides in learning to look across the table and see an individual and love them, regardless of who they are, regardless of where they come from. Long-term recovery really is, I believe, something that an individual needs to look internally for themselves and assess themselves and ask them, are they growing in a spirit that is connectedness with others as well as becoming the best version of yourself?
Most important part is once you get into recovery, boy, you can help the next person who might be suffering. And that's the most important part. As we continue in recovery, we find out, we know that we can't do it alone. We have to be part of a larger group of ourselves, the other people in recovery. As they say, it takes a village, it takes a ton of people and great people to stay in recovery, and then you can be a part of the solution and not the problem.
I'm going to tell you that life shows up, and I like to share with people, it doesn't get better. Life doesn't get better, but we get better. We get better when we allow ourselves to be willing, to have a willingness to understand that others have gone this path and can share some experience with us that we can take in, and we can know that each day gives us a promise that if we don't pick up that first drink or drug, we won't get drunk or high. That's the honesty of it, and allow ourselves the opportunity to get better inside. So I need to say, for the first responders, for the law enforcement, for those that are on the front line, doing their due diligence day in and day out, saving lives, you may not see what happens on the other side, but know that you have put your best foot forward, you have persevered, you have done your due diligence and your professionalism and your courtesy and your dignity to giving life to that individual. It goes a long way. Some mother, some father, some brother, some sister, some aunt or uncle or cousin is thanking you today for the work that you've put forward, that you spared no time in making sure that their loved one got the help that they needed. And for that, we say thank you.